wasn't easy. Men, everybody, get checked out. Because if it wasn't for me getting tested for something else, they wouldn't have stumbled up on this.
The big news today, Coach Prime is cancer-free. We learned that in a press conference. He was treated for bladder cancer. And joining us now is health expert Dr. Payal Kohli to talk about what we've learned today.
And I'm so happy that you're here because I know that a lot of people have questions. One thing that really came through this press conference was the idea of you can discover your cancer early when it's most preventative by these routine checkups. So one, I want to hear about the importance of that, but also he brought up being cancer-free, but then his doctor mentioned the word cure. Can you really be cured from cancer? Is it typically cancer-free? You know, I've had experience with cancer in my family, so I just wanted to have that discussion as well.
Yeah, so I think really important to see the doctor regularly, especially with a cancer like bladder cancer that's more common in men than women, 3 to 4 times more common. In fact, 10 to 20% of cases of bladder cancer may not have any symptoms at all, and about 30% of cases can just have microscopic blood in the urine. So unless you're actually putting the urine under a microscope, which is not going to happen unless you go to the doctor, you may not pick it up. So I'm so glad that his cancer got detected early because that's why he's cancer-free. And I'm glad you asked that second question, Sam, about cancer-free versus cure. Because if I was his oncologist, I would not use the word cure because I think a cancer patient is never fully cured. Something about his risk factors, something about his underlying biology, something about his underlying physiology has made him have this cancer. So could it come back someday? We can't predict the future. We hope not, but certainly there's always that possibility. So I use the word cure when I can guarantee my patients that it's never coming back. Certainly we want to be cautiously optimistic because he is cancer-free today and we want to celebrate that win.
There was a lot of discussion, I think 2 or 3 times, he talked about this as like a warning to other people out there, particularly men. He drew a point to talk about African-American men who don't like to go to the doctor, and then he broadened it out to different demographics. So what is it about men that don't like going to the doctor, and I don't know if we can say, will you see spikes because of this? They'll see someone who's a power figure, oh, if it can happen to him, then yeah, maybe I should go to the doctor. Or is that just a fallacy?
No, it's very true, in fact. So 1 in 3 men say they would only go to the doctor if there was something seriously wrong. 60% of men.
And then it could be too late.
Yes, 60% of men don't get annual checkups or routine visits. So you're talking about most of our men falling through the cracks, and this being what we call the gender gap in medicine. And there's a huge cultural barrier for men to go to the doctor, where they're considered weak if they go to the doctor. It's considered macho to stay away from the doctor. And the types of men that stay away from the doctors are the ones that need them the most. They're the ones that have limited health literacy, so they don't know what to be looking for. They're the ones that have limited access to care, men in rural areas, men without insurance, and younger men, 30 to 50. So unfortunately, everyone who needs to go to the doctor are the ones that are most likely to stay away. And leveraging these kind of public figures, I think, is so powerful because it normalizes that conversation, especially when it comes to urogenital cancers in African American men. So the American Cancer Society has this quote, which I love, which says that racism, not race, is a risk factor for bad cancer outcomes.
Wow, that's powerful.
So it's systemic racism of the system where we don't get our men of color plugged in nearly as much as we should. And these kind of people, I think, can really help us change that narrative.
So we only have about a minute left, but I want to quickly talk about the lifestyle changes. What is he going to now have to deal with?
So now he doesn't have his own bladder. He has a fake bladder, neobladder, which is made out of his intestines. And so he's going to have to change the way he lives his life. He's going to have to wake up 4 to 5 times a night to urinate. He's going to have leakage. He's going to have incontinence. He's going to have a higher risk of urinary tract infections. Now, the trade-off is that he's made himself cancer-free. Whereas if he had taken the conservative option of bladder sparing, he might have had to have more frequent surveillance, and the risk of recurrence would have been higher. But this is certainly something he's going to have to learn to live with, just even how to urinate, how to drink water, how his intestines might change because he's had intestinal surgery as well with a piece of the intestines removed. And he said he's lost 25 pounds. So I really hope that he can rebuild that strength and get back to that same level of functioning.
I can see how people will hear what you just said and say, that's exactly why I don't go to the doctor, because I won't have to do that if I don't go to the doctor. But let this be a lesson that because he went to the doctor,
it saved his life.
Yeah, he's alive today.
It saved his life. Yes, great point, Marshall.
Thank you so much, Dr. Kohli. And you can find more with Dr. Kohli on 9news.com/Dr. Kohli.